Ministers of the government, Tushar Nicholas Fredericks, Chairman, members of the National Assembly, members of the Diplomatic Corps, members of the National Tushars Council, Tushars, invitees, members of the media, ladies and gentlemen. Development would be meaningless unless people's lives could be improved. Human development is at the core of ensuring a good life. It recognizes the importance of improving people's lives, especially in 4 fields: education, health, livelihood, and social protection. Human development aims at ensuring the good life for all. Indigenous people inhabit all 10 regions of Guyana, mainly in the hinterland. Human development in Guyana therefore must mean hinterland advancement. The United Nations Development Programme's Human Development Report 1990 noted that, and I quote, "People are the real wealth of a nation. The basic objective of development is to create an enabling environment for people to enjoy long, healthy, and creative lives." The report emphasized that education, health, and decent standards of living are essential to the good life. I add a 4th as essential element, and that is social protection. Guyana is moving towards becoming a more inclusive and equal society. This means that hinterland human development is imperative, especially in those fields: education, health, livelihood, and social protection, 4 essential fields of existence and human endeavor. My friends, hinterland human development has improved appreciably over the past 4 years. Indigenous peoples are enjoying better access to public education, public health, public information, public infrastructure, public security, public telecommunications, and social security. Progress in these 4 essential fields of human development, education, health, livelihood, and social protection, has been measurable. The persistence and gravity of social ills such as alcoholism, child labor, drug abuse, sexual abuse, and teenage pregnancies, however, should not be allowed to derail progress on the path to development. The eradication of social ills and the elimination of extreme poverty require intensified cooperation among regional democratic councils, the RDCs, the National Tushars Council, the NTCs, Indigenous Village Councils, and the central government, particularly through the Ministry of Indigenous Peoples Affairs, led by Vice President Sidney Alicott. In terms of education, public education is indisputably a pillar of national development. Our government has invested $170 billion in public education over the last 4 years, and a further $52 billion committed to 2019. Hinterland education gained a good share of these investments and is being improved continuously through the establishment of learning resource centers in several regions, the school feeding programs, which benefit more than 20,000 students in over 216 hinterland nursery and primary schools and annexes, through the public education transport service, which is providing bicycles, boats, and buses to transport hinterland children to school, especially in the riverine areas, through scholarships, which will be awarded to 13 top performers of the National Grade 6 examinations in the Rupununi region by the Ministry of People's Affairs, Indigenous People's Affairs. The number of hinterland scholarships has increased from 110 in 2014 to 187 today in 2018, last year in 2018. Hinterland students also have been among the beneficiaries of the 1,600 tertiary level scholarships offered by the Department of Public Service since 2015. Residential accommodation benefits 2,240 secondary school students in the 4 hinterland regions: Barima, Waini, Kuyuni, Mazruni, Katara, Siparuni, and Rupununi. I commissioned the $186 million hinterland student dormitory on the 15th of July this year at Liliendal, and this will provide accommodation for 120 hinterland students pursuing tertiary education on the coastland. My friends, in terms of health, hinterland health services have been upgraded over the past 4 years and are being expanded further. Health clinics, which provide medical services to indigenous people, have been rehabilitated. Health professionals have been deployed in the hinterland to boost healthcare delivery. Emergency healthcare services have been improved with the addition of new water ambulances in riverine neighborhoods at Barakara, Karawab, Tukwani, Maruka, Orial, and St. Monica. Vaccination and immunization against preventable diseases have benefited hinterland communities. Vaccination coverage to help fight preventable diseases reached 90% coverage. Malaria cases, most prevalent in the hinterland, have reduced from nearly 18,000 reported cases in 2014 to just 11,000 in last year. Potable water supply is helping to improve health by reducing the risk of waterborne disease and enhancing sanitation. Water systems were or are in the process of being improved at Kamawata, Kanuku, Marburuma, Matthews Ridge, Mokomoka, Port Kaituma, Rupanau, Sand Creek, Shiriri, Surinab, St. Ignatius, and Whitewater. In terms of livelihood, higher standards of living for indigenous people can be assured by improved access to public services, such as infrastructure, telecommunications, and security. Your government has continued to narrow development gaps between the coastland and the hinterland in the provision of these services. The Hinterland Sustainable Agricultural Development Program has improved food security through the expansion of hinterland agriculture and agro-processing in the Barima, Waini, Kuyuni, Mazruni, Pataro, Siparuni, and Rupununi regions. Hinterland farmers have benefited from the services provided by these programs. The Hinterland Employment Youth Services, you've heard, and the Youth Entrepreneurship and Skills Training Programs have been stimulating job creation and entrepreneurship within indigenous communities. Jobs are important in providing incomes for households and in diversifying and stimulating the village economies. Hinterland infrastructure is being improved. More than 30 hinterland aerodromes have been rehabilitated to improve transportation links. 350 kilometers of hinterland roads have been rehabilitated and maintained. Roads have been upgraded in the 4 new capital towns, Bartica, Mabaroma, Madi, and Lethem. Works have been done to major roads, linking Rockstone to Mabura, Kurkokari to Anai, and Linden to Mabura. A new bridge was constructed across the Maruka River to replace the dilapidated structure. Other bridges have been built or are being repaired in other regions. As you heard, telecommunications connectivity has been improved in hinterland communities. ICT hubs have been established in 171 communities. ICT hubs are scheduled to be established in more communities in months to come. Birth and death registration services have been extended by the Department of Citizenship. Legal services, including through the registration of businesses, have been extended through the creation of new magisterial districts in Linden and Lethem. And Lethem is now a town. The commissioning of courts of Karasabai and Aishalton, and the construction of a new magistrates court at Madhya, which is now also a town. This business development will offer greater opportunities, including employment for people Your government is working to expand business within the hinterland regions. It is establishing new business registration hubs in 6 regions to make it easier to register businesses. Industrial estates are being developed at Lethem in the Rupununi and Belvedere in the East Berbice Quarantine region. A frontier village policy was unveiled last year to improve security of border communities, especially in the Berima-Waini region. We now have over 10,000 Venezuelan migrants in the country, coming mainly through the Berima-Waini region. The frontier village policy is helping to make the hinterland border communities safer from attacks from the sindicatos and excursions by illegal miners and contraband smugglers. New police divisions have been established in the Berima-Waini, Piguni-Mazruni, Bataro-Siparuni, and Rupununi regions. Things are happening, my friends. In terms of social protection, we realize that social protection is integral to human development. It is necessary to protect citizens and to ensure that they could enjoy decent and dignified lives free from abuse and deprivation. The Ministry of Social Protection has been making interventions to improve hinterland and social protection services in collaboration with other government ministries. The situation between Yarta in 2015 was disturbing. The Ministry of Social Protection, in collaboration with United Nations Children's Fund, undertook a survey of women and children in Guyana entitled A Situational Analysis of Children and Women in Guyana in the period 2015-2016. Some of the findings were distressing, especially as far as they relate to indigenous women and children. Children living in indigenous communities have 3 times more chance of having diarrhea than children in other parts of the country. Children living in indigenous communities have the highest rate of acute respiratory infection and stunting of all ethnicities. 4 out of 10 indigenous children are believed to be involved in some form of child labor. 6 out of 10 indigenous children were not attending nursery school in 2014. 1 in every 5 indigenous boys and girls was not attending secondary school. These and other social maladies could hamper the development of indigenous communities. The situation is serious and suggests urgent action and cooperation among all of the stakeholders. The RDCs, the NTC, the Ministry of Indigenous Peoples Affairs, and the Ministry of Social Protection itself. We've intensified our anti-human trafficking campaign and taken steps to reduce labor violations, especially in the mining sector. Increased training and awareness education programs to combat sexual offenses and domestic abuse, and installed child advocacy centers in 6 regions, and these will be expanded further in order to combat child abuse. My friends, hinterland development is about human beings, it's about people, but we are on the right path. Hinterland communities must, however, not allow themselves to continue to be bedeviled by social ills which act as a brake on development. I repeat my appeal to the NTC in 2017 to work together to reduce the incidence of alcoholism, incest, murder, non-communicable diseases, people trafficking, prostitution, substance abuse, teenage pregnancy, and suicide in certain communities. I noted then that antisocial behavior undermines the cultural fabric of communities and lowers everyone's quality of life. I call attention to the fact that in one indigenous community, tragically, there was a report of over 7 suicides in 1 year, per year, for a decade. Cooperation among stakeholders is needed to arrest social decay. My friends, the next 10 years offers us an opportunity to do so. I refer again to the United Nations. The General Assembly of the United Nations adopted a resolution entitled Transforming Our World, the 2030 Agenda for Sustainable Development. This was adopted on the 25th of November 2015. The agenda is commonly known as the Sustainable Development Agenda, and its political declaration observes, and I quote, "All people, including indigenous peoples, should have access to lifelong learning opportunities that help them to acquire the knowledge and skills needed to exploit opportunities and to participate fully in society." The agenda established 17 Sustainable Development Goals, which corresponding targets and indicators intended to set the world on a path to sustainable development up to the year 2030. Guyana endorsed the agenda and incorporated the 17 Sustainable Development Goals into its Green State Development Strategy, Vision 2040. The United Nations member states committed themselves, and I quote, "to implement the agenda within our own countries and at the regional and global levels, taking into account different national realities, capacities, and levels of development, and respecting national policies and priorities." The agenda affirms the right of each government to determine how the SDGs' aspirational and global targets will be incorporated into national planning processes, policies, and strategies. And I urge the NTC to pay attention to the SDGs to help to incorporate them into their own planning for the next 10 years. My friends, the period between 2020 and 2029 will be a decade of development for Guyana. The decade aims at promoting a more equal society, one in which everyone could feel a sense of belonging and share in national development. The objectives of the decade will be aligned to the UN's SDGs. The decade will promote measures aimed at closing the development gaps between hinterland and coastland. It will aim at ensuring that indigenous peoples, among others, would not be left behind. It will seek to promote measures aimed at solving the social problems which handicap indigenous people and hamper human development. The SDGs are important to human development. Their targets and indicators are useful measures by which to assess progress during the decade of development while we address human development. For example, SDG number 1 has as its aim to end poverty in all its forms, everywhere. It calls for states to eradicate extreme poverty for all people everywhere. The decade of development will allow us to do so by 2029. It will allow us to eradicate extreme poverty in Guyana. SDG number 2 aims to end hunger, achieve food security, and improve nutrition and promote sustainable agriculture. It calls on countries to end hunger by 2030 and ensure access by all people, in particular poor people in vulnerable situations, including infants, to safe, nutritious, and sufficient food all year round. The decade of development will aim at ensuring that by 2029, no indigenous child goes to bed hungry, no indigenous community will be unsafe, and that nutritious and sufficient food will be provided for everyone all year round. SDG number 3 has as its aim to ensure healthy lives and to promote well-being for people of all ages. It calls on states to reduce the number of deaths and illnesses from hazardous chemicals and air, water, and soil pollution and contamination. Water safety and sanitation are vital to achieving this target. Hinterland creeks and rivers must be protected from pollution, including from mining effluent and mercury. These waterways are used by our indigenous people for bathing, drinking, cooking, fishing, and washing. They must be kept clean. We are a signatory to the Minamata Convention on Mercury. Guyana is committed to phasing out the use of mercury in the gold mining sector by 2030, on condition that viable alternatives to mercury can be found. The decade of development will promote safe water, sanitation, and hygiene services for indigenous communities. SDG number 4 aims to encourage inclusive and equitable quality education and promote lifelong learning opportunities for all. It requires that all boys and girls complete free, equitable, and quality primary and secondary education, leading to relevant and effective learning outcomes by 2030. It requires a substantive increase in the number of youth and adults who have relevant skills, including technical and vocational skills for employment and entrepreneurship. The decade of development will ensure that by 2029, all indigenous children have universal access to both primary and secondary education, and an increase by 50% in the number of youths and adults who are trained in technical and vocational skills. The decade of development aims at eliminating hunger, ensuring food security, safe water and hygiene, enabling everyone to access universal primary and secondary education, and expanding technical and vocational training opportunities for indigenous peoples. I've identified 5 targets which are achievable and which could improve substantively and substantially the quality of life of indigenous peoples by 2029. I believe that these are realistic goals which can be achieved within the decade, and I urge NTC to examine them and adopt them. I urge the NTC Conference 2019 to endorse these 5 fields of action for inclusion in the objectives of our decade of development, 2020-2029. My friends, the National Nutritious Council conferences are annual opportunities to expedite plans for social and economic improvement. These conferences are occasions for indigenous leaders to review the progress they made in developing their villages and to renew their commitment to improve the lives and livelihoods of their people and to repair and remodel their village improvement plans, the VIPs, for future years. The NTC, in accordance with the Amerindian Act, is responsible, among other things, for the preparation of plans for promoting hinterland human development. The Council must do so. I look forward to working with the NTC to further hinterland human development. We have made great progress in hinterland human development, but there is still much work to be done. The gap between hinterland and coastland remains wide. I iterate, however, that people are the real wealth of a nation. The basic objective of development is to create an enabling environment for people to enjoy long, healthy, and creative lives. I'm confident that we will make a real change, a lasting change, a positive change in ensuring that the essentials of human development, education, health, decent standards of living, and social protection are realized within the next 10 years. With these words, I commend this program to you, members of the NTC, and wish you well in your deliberations during the week. Thank you, and may God bless you all.